In July 2008, Kenya Medical Research Institute, or KEMRI for short, continued testing children for malaria immunity in the highlands of Kenya.
Because we are a population of about 326, and you would find that in a week, before a week elapses, you would get maybe about 10 children, 15 children who are sick.
Malaria is the greatest killer of children under age 5 in Africa, resulting in nearly 1 million deaths. Shalee, a student at Iguhu, has malaria. The anopheles gambiae mosquito is the most notorious transmitter of the disease.
As you know, mosquitoes are arthropods. These are insects that do not control the internal temperatures. The control of the temperatures inside mosquitoes is entirely dependent on the external temperatures. If it's very cold, the whole system goes slowly. The development of mosquitoes takes a long time. Development of parasites within the mosquitoes takes a long time. And if it gets very cold, the whole system basically shuts down. However, if it's warming up, then it revs up the mosquito cycle, it revs up the parasite cycle, and it gets to a time where transmission can be sustained, particularly in the highlands, and then you get epidemics coming up, you get increased transmission.
Dr. Andrew GITHEKO realizes that Shalee is sick and takes her to a hospital just down the road from her school. Symptoms of severe cases may include kidney failure, coma, or even death. But symptoms of clinical cases may be more mundane and harder to discern from other diseases.
Children who have malaria, the presentation is actually quite wide, but most of the children would come with fever, they would come with vomiting, poor appetite, and you can actually confuse it with any other febrile illness.
The hospital that Shalee visits sees mostly malaria cases.
The main cause of patients being sick is malaria. Let me say about 70% of the patients we have is malaria cases.
Shalee is treated with Quartem, an anti-malarial drug. Many Africans, however, cannot afford such drugs, and there is no guarantee the drug will entirely eliminate the disease from the body.
We find that since the emergence of drug resistance, mortality from malaria has gone up. I mean, there is increasing mortality, and even people getting sick. The burden from malaria is becoming more, simply because the drugs are not effective enough to clear parasites, and so people get sicker and they're likely to die from the disease.
KEMRI scientists are aware of the issues concerning drugs and are researching low-cost and low-tech prevention methods for malaria, like bed nets.
Basically, when the mosquito comes in contact with a treated net, she picks up the chemicals from the various parts of their limbs. And sometimes if the chemical dose is very high for one limb, we have seen situations where the mosquito that limb just breaks off and falls off. And then they can drop off a few limbs, then they cannot fly anymore. And then they get killed.
How many of you slept under a bed net? Neti. Wangapi walilala chini ya neti?
While many children at Iguhu still do not sleep under bed nets, the number has increased in recent years and may be contributing to a decline in infections that teachers have seen.
That used to happen sometimes, but before the KEMRI started making their research around here. But ever since they came, the number has reduced. We had those cases, they were very common, but right now they have reduced. The number is going down, it's going down.
The immunity test determines if the children have plasmodium in their blood. The test shows if children have an existing immunity, were previously immune, or have no immunity.
Our findings are that 12% of the students have immunity, while the rest of 88% don't have immunity. And this is because they've lost it. Either they've lost it or in the recent days they've not been exposed to malaria parasite. In the past, around 46.4% students have immunity, which shows that the students who have the parasites have reduced, and the parasite infection has also reduced.
During my time in Kenya, I became the first white person to take KEMRI's immunity test. Like an increasing number of the children at Iguhu, I have no natural immunity to malaria.
I'm worried about this
KEMRI is exploring other low-cost methods of prevention. Putting a papyrus ceiling in a home, for example, may prevent mosquitoes from entering a house through the eaves, thus reducing infectious bites by 80%. Planting grasses along pools of water may cool the warm waters mosquitoes grow in best, and reduce their numbers by, again, 80%.
Now, these new initiatives using very simple tools like bed nets are showing great promise that actually malaria can be controlled. Now, we need to sustain this effort to a point where Africans themselves will be able to actually meet the cost of control. This may be another 5 years, 10 years, but I believe as the health of Africans improves, the economies will improve, and they will be able to sustain these efforts themselves.
Dr. GITHEKO is hopeful these methods will help Africans become more economically independent and live healthier lives. Let's hope he's right.